Hey everybody, this is Dan Gates from the AIDS Support Group of Cape Cod. I am here with Gwynne Guzzeau of HOW and Morgan Clark, Provincetown's Health Director. This is our first Zoom video feed for social media, so we're going to try to keep it interesting. We're going to try to keep it somewhat brief, and we will try to be professional. We wanted to come together today to share with the community a little bit about our work on the Provincetown Recovery Coalition and to give people information on the survey, which we're hoping as many people as possible will fill out this week. It came out Monday night. It's available on various websites within town. Is it on HOW's website by any chance, Gwynne?
It will be by the time this interview goes live.
Excellent. And it's on asgcc.org. Just click on the COVID-19 updates. It's on our Facebook page. And Morgan, where is it on Provincetown's site?
If you go to the homepage, which is provincetown-ma.gov, there's a box at the top to get all the COVID-19 information. So you just click through to that and there'll be a link to the survey. It's also on the Recovery Coalition's Facebook page and the Health Department's page.
Excellent. Well, I would say one of the things that has been a joy of this process is I've gotten to spend lots of time with Gwynne and Morgan. We've had more Zoom counts or meetings than anyone wants to count. So Morgan, I'm wondering if you could tell us a little bit about the social services aspect of the Recovery Coalition. But before you do, I already remember I did not tell one little part of it. I did. I've already messed up the recording. Go on, Morgan. Answer that question when you can.
Absolutely. So as you mentioned, the coalition is to advise the town manager on a phased reopening. And the town manager has a great group of people representing all sorts of sectors and subgroups on the coalition. So there's also folks representing the business community, town government, public health and science, and then our group, the social services. And it was a great thing to seg into the Recovery Coalition because, as you know, we've been running at least once a week meetings with all local social services, public health, and charitable organizations, as well as our local churches, a call talking about meeting needs and how we can provide services during the state of emergency and what gaps and problems have arisen in our community since the state of emergency. So that's a natural thing for us to then be able to communicate up the chain to the coalition as a whole and to the town manager to make sure that she's aware of those problems. But I think that you all have other meetings as well on a regular basis. So that's just one example of how we're all in communication, and then there's actually somewhere to bring that communication to. Dan, why don't you talk about why the survey, why now, and why we did a survey?
Oh, sure. So making sure we were representing the various communities within town was, I think, one of the primary purposes of this. And so I know I was really honored that ASG was asked to have a seat at the table, and I'm sure Gwynne feels the same way. So our task was, how do we make sure we're reaching as many people in town and getting from them feedback on various domains, which I should let Gwynne speak to. But it was really about how do we talk to as many people as possible, make sure they're being heard. And also, we have guest stars on this video. I think we might have to do a dog introduction right now, Gwynne.
I got a dog at home and a teenager who I just told to go away because I forgot to tell him we were recording.
That's fantastic. We're going to keep going. Gwynne, do you want to say a bit more about the survey and some of the domains we touched on?
Sure thing, but I guess one of the things I just do want to echo is that one of the key reasons that I said yes when Morgan called was that I could work with both of you, and that in the social service sector, we are essential businesses, and we've all been hitting the ground hard, and many of us feeling like we're working harder than ever before to provide services to people in need right now. And so some of the key areas that we wanted to make sure we covered in this survey, and some folks I know I've spoken to have said, gee, Gwynne, why is it a little bit so long? And I'm like, well, there's a few questions in each category, but we want to know about your concerns, different behaviors that it might have changed. We're really looking for a baseline of information here. We want to know how you're using healthcare or how you want to be able to use healthcare, questions on financial security and food security, as well as your state of emotional and mental health and well-being. I know for myself, it's been an important time to reach out to professionals and friends to create support in the stress of what we're all going through. There's, of course, some other questions we have about how you're getting information about what's going on and demographics. So those are some of the areas that we're hoping you'll take the time to give us a broader sense of what your needs are and what you're experiencing right now.
Absolutely. And I guess we should mention, so the survey was designed to take about 15 minutes. I've gotten some feedback from people that it is as quick as 15 minutes. Some people, if they're taking a little bit more time, you can be as thoughtful as you like. It's not a race. It can take 25 minutes or so, but it is a really comprehensive survey that's been put together so far. One thing I really liked, Morgan, that you did, if maybe you could speak about it, is the way in which you used questions that have been used elsewhere so that we have data that we can share. Would you want to talk about that?
Yeah, absolutely. So most of the questions do come from pre-tested national surveys. The idea with using those survey questions was that they had been tested. So testing survey questions hopefully eliminates misinterpretations or ambiguity in questions, and that work's already done. So then we could just take, and for the ones that we had to make more specific to Provincetown's situation, we certainly did. But the questions are predominantly from national pre-tested surveys. So you will see some questions that are specific to our population that weren't pre-tested were also they were a result of some policy decisions or conversations about policy decisions about limiting parking or limiting public restrooms, which are right now closed. So we want to hear from the community about whether that does work for population control, or whether it's affecting folks that need those services and are still here and live here. So that's the kind of thing that we did have to make more local. Sorry, Gwen, what did you want to add?
I just wanted to emphasize that another reason that I said yes to this and I care a lot about it is because it's quality. And the team that's come together under Morgan's leadership and the town manager, the fact that we even have peer-reviewed questions and things from broader national and just public health resources, I think the community should be reassured with the depth of quality of leadership in this information gathering project that the community survey represents. And that's really important to me in my work and in working on teams. And I just really wanted to say that, express that respect. And I know we've talked about that a number of times. It's mutual, but your leadership is really critical here. And thank you for that.
Thanks, and thanks for you both for taking part, because I couldn't do it without you. I do want to mention that the survey is this tool to get a baseline of information, but it's also, there are sections where you have the ability to request to be connected to services, I think at least 3 times. Mm-hmm. And for people wondering, that information will be kept completely confidential, but since we're asking about whether you have enough food to eat, you have the opportunity, if you say no, to give us your name and number so that we can connect you to folks who can connect you to services for food. And I think it's the same in financial security and connection to services in general. So just know that's there, and it'll be completely held confidentially. We won't be confusing if you ask for services over here, we won't be connecting you to services over there. But we did want to have that interactive component as well with the survey. Because like I said, the groups of agencies that provide services are meeting really regularly, at least once, if not twice a week, and discussing things. But if you're not already connected to those agencies, then those agencies can't speak for you, right? And I think that's we know that there's people who aren't, and that's fair. Maybe you didn't need anything before this all happened in your situation. You know, none of us could have predicted how this unfolded. So maybe you need things now. And so now's the time to let us know so we can fold you into, because we've got great services. There's a lot available in this community, and we want to make sure that no one's left out. Public health is all about the health of the public, right? That's the difference between public health and medical care. You know, you go to the doctor, they're just treating you, but public health is about treating the entire community and, you know, making sure that the most vulnerable are protected. And so this is just one of our many steps.
You know, and Morgan, I think I want to point out too on that one way people can access this survey other than the online portions, if you're watching this, you probably have an internet connection, but you may know people or have family members or loved ones who don't have internet connections. So there are agencies in town that will actually help people by walking them through the survey. So for instance, if you know someone who needs to, they could call us at the AIDS support group. We'll have a case manager call them back within a couple of hours, and we will do the survey with you over the phone, and we will enter it on the computer so that your data is collected, because it's really important that way that everyone has a voice. This, I don't know if we mentioned it on this, but I want to make sure we're clear. It's for anyone who lives in Provincetown, anyone who works in Provincetown, anyone who has kids that attend school in Provincetown. And Morgan, when we say live in Provincetown, could you just speak to what that means? Because some people may be wondering that.
Sure. There's a question where you can just say, if you only live here a part time of the year, that's fine. We're looking for anybody whose lives are interconnected with Provincetown community. Like, you are all a part of our community, and we want to hear from you. So anyone who lives in Provincetown for any part of the year, or works in Provincetown, or who has kids who go to Provincetown school.
Right. Thanks for that, Morgan. Okay, so before we wrap up, Gwynne, I had a quick question for you.
What's that?
So you're really busy and you're making time to participate with this. What are you noticing so far? What are your hopes for this project?
I really like the way the project's designed, that the coalition might be a small group of 18, which isn't really that small, or some number like that. But then we turn and go out to our stakeholder groups. And so there's an opportunity for people to engage, and the people who have wanted to volunteer or engage can reach out through that coalition, that Provincetown email. So to me, the overall structure is important. That it's not simply one small group sitting together deciding stuff and advising what we decide to the town manager, because we don't have authority, we're advisory. So that structure is so important to me. And in the end, I know the stories of the, about 140 women that live in Provincetown that we serve. And I don't know all those stories. I only know parts of those stories. And so when I come to these calls, I have that lens on it, and the lens of someone who works off in the Lower Cape and comes into town when I do on a weekly basis now. So this idea of broadening the information and across these subgroups and these stakeholder groups is really, to me, the kind of organizing and decision-making process that shows that we really are taking in input. And that matters to me a lot, where I want to spend my time as a leader and as an advocate. So that's why I've been making time, and I find it energizing, and I've made new connections to local business leaders that I don't even know. I know their businesses, but I don't know the faces. So for me, only being in the role about a year and a half now, it's also been good to just meet some people that I only know by name at this point.
Well, fantastic. I will just say ditto, which is what I say on many of the meetings I have with you. After you speak, I say ditto to what Gwynne said. So we should wrap up. I want to make sure we have the email out there for everybody. So the email, if you have any questions about this, is coalition@provincetown-ma.gov. Again, that's coalition@provincetown-ma.gov. The survey is available on the town website. As Morgan mentioned, it's on the HOW website, and it's on the AIDS support group website. Our website is asgcc.org. Gwynne, is it helpingourwomen.org or is it HOW? It's spelled out, right?
Yeah, it's spelled out, helpingourwomen.org.
Okay. Well, I have loved working with you guys. I know we probably have 5 more meetings before tomorrow that we'll see each other on. But thank you for taking the time to do this. And I want to echo what Gwynne said. Morgan, your leadership has been amazing. I'm really honored to be on this. It's wonderful working with the town manager, but I am daily impressed by all you are doing. So thank you.
Thank you. Thank you both.
Thanks, Dan.
Thanks, guys.
Bye.
Bye.